Okay, great.
Awesome. Okay, great. Can you see my slides?
Yes.
Awesome, wonderful. Well, thanks so much for having me, Michelle. As a former teacher, now a parent, I appreciate the work that y'all are doing to help students be healthy and well. I think that's super important to their ability to learn. So I'm excited to join y'all. So as Michelle said, I'm a staff attorney with TASB. So I'm going to be giving an update on some of the bills that were passed that I know are relevant to you all in regards to student health and nutrition issues. Michelle was very kind and sent me some of your questions beforehand, so I was able to find the answers if I didn't know the answers. So hopefully I'll touch on everything that is coming to mind, but I know there are lots of questions out there. We keep getting questions here at TASB. So if you have a question, put it in the chat and I can look at it later, or Michelle can let me know what's going on there. But I am going to start with some of the really hot topics. Let me see. All right. So SB 12, which is all about parental rights. It's a pretty large bill that has been signed into law now that just touched on just about everything. But what's relevant to you all is the consent to medical, psychiatric, and psychological treatment of a parent's child and how you go about getting that consent and what do you need consent for. Um, so I'm going to talk about some of that. Um, this one has been a really hot topic with TASB because when we would read the bill, we had one, before TEA was able to put out some of their guidance because this was all a very tight turnaround for districts. Um, we had one answer, which was based on what was written in the statute, but we've since gotten some clarification that I think is very helpful. So I'm going to show you where you can get some of that clarification and what forms you can access just as a general member of the public. And then you'll probably notice I have not included links or resources to TASB resources, just because I don't know who all in the audience today has access to that. But if your school district is a TASB member, you can certainly reach out to your campus principal or supervisor who can see if you have access or they have access to some of our documents as well. But so far, I've just included the TEA guidance, which I think is wonderful and really a good place to start. So I know that there's been some questions from the beginning about what is a health care service and what is a health related service. So to address that, TEA updated its guidance um, and talks about what is a healthcare related service that requires notification, but consent is assumed to be provided absent a parent submitting notification of their withholding of consent. And then healthcare services, on the other hand, which require parents to opt in by providing active, informed consent before the service can be administered absent emergency care situations. So, a big one that was coming up for us was first aid. Can a nurse, look at a scraped knee and give a Band-Aid? So this would be considered a one-time treatment, potentially a few follow-up observations, and that could be provided by a medical or non-medical professional. We know kindergarten teachers can pass out Band-Aids. And so that would not need that required active informed consent. It would be something that would be you would let them know at the beginning of the year. We provide these services as part of our health related services. They're not healthcare services, so you don't need to get active consent for that. The other one would be the concept of general caregiving. What does it mean to care for students? It's been defined and identified as neither a healthcare related service or a health related service. So it can be provided generally, and that would be things like washing hands, you know, checking for do they have a fever, things like that. All right. So some of the consent forms that are available. Um, so this consent form is available on the TEA website, and it's not specific to healthcare consent forms. It's just the general parental rights and options information page. This should be provided to parents each year, and it provides information on all of the parental rights. It's available on TEA's website, which is linked here, and we'll be sending out these slides. Don't feel like you have to write everything down. We'll send these out after the presentation. This is going to be different than the model form for healthcare related services that TEA is putting out. So TEA has come up with some model language in a form that's available here. This is just one version. It's not a requirement to use this form. But this can give you an idea if you're still drafting your consent forms, or if you're wanting to know what needs to go into the consent form. This is a good place to start. TASB has also sent out a form you could use, so that might be something your district's already using. But this is going to talk about, your healthcare related services and what you're providing, and then the parent can opt out. But they also can just return it and sign it and say, I'm fine with you providing these services. I do want to point out a very helpful guide is the TEA FAQs, specifically on SB 12, and this is linked here as well. I think this is really helpful for understanding how the statute works in action for districts. So like the general caretaking, you can offer a change of clothing if they get sick, or helping them clean up spills or other accidents, checking their forehead, do they have a fever? You can do all these things. It's not considered a health related service or a healthcare service. I know that there's been a lot of questions about what can our nurses do? What do they need consent for? So these FAQs on the TEA website address a lot of those scenarios. So that is where I would also start if you have questions. I also, Michelle sent over, there was a question about the fitness gram pacer test. And I've talked with the attorneys, and we think that's not a health care related service or a health care service. So that's just part of your physical education curriculum. And you don't need to have consent for that test that you're doing. So the kids don't get out of running. Okay, so we're going to move on a little bit from SV 12's consent issue and more into some of the other parental rights and prohibitions that they've put on certain types of education. So I'm not going to touch on some of it, but there is a prohibition on the instruction of sexual orientation and gender identity. So if you have like a human sexuality course, you may need to change it based on SB 12. And then the bill also changes. I know it's gone from opt-in to opt-out to opt-in, but now currently the law is that before providing instruction on human sexuality, the district has to have written consent from the student's parent saying that they can participate. And I think this is important to note that the request for the consent on the human sexuality course needs to be separate from any other notification or request. So if you're going to be sending out like a packet of these are all the things we provide in terms of healthcare or health education, the human sexuality ask for consent should be completely separate. I would send it out probably at a different time so that parents know that what they're opting into and they have the ability to take time to read it.
Hey, Kelsey,
Yes.
just a quick question because two people have
Yeah.
already asked.
Okay.
Are height and weight allowed? through physical education classes. Those are things that have always been part of fitnessgram.
To measure.
Yes.
I think
Without,
that's probably fine if it's part of the tests and the curriculum.
okay.
Yeah, I wouldn't go any further. I wouldn't go into any kind of like assessment of what the weight means. Like this is their BMI and this is, but maybe that's what it's part of is giving a BMI. Um, I would steer clear of going from fitness to the medical interventions. Because that would take it from just a physical fitness test to now you're giving like a diagnosis or a medical assessment.
Okay.
Mhm. Um, so kind of in line with the fitness gram, we're going to move on to SB 25. And this was a fairly short statute change, but it prohibits a school employee from restricting a student from participating in recess or physical activity that's provided as a penalty for misbehavior disruptions in kindergarten through eighth grade. So, th this is basically all the statute says, and I know it's caused a lot of questions. But I think the spirit of this is that kids should be moving. They should be getting that physical activity throughout the day. So there were some questions about providing alternatives during recess. Is that considered withholding recess? I think it depends on what that alternative is. If the alternative is you're going to sit in a chair and do your homework that you didn't do, I think that that's probably not a good alternative. The student needs to have that time, that 20, 30 minutes to be moving. So I would say the safest bet is to let the kid participate in recess or do some version of physical movement and allowing them to participate. Another question was if a student is misbehaving, acting out in PE, can they be sat out as a consequence? Um, Again, I would say if the sitting out is almost literal, like you're going to sit on this bench while the rest of us play flag football or a soccer game, I think that's prohibited by SB 25. I would say that the student needs to be active in some way. So they're not sitting, they're not participating. It's up to PE teachers of what that might look like. But maybe what is a different way that the student can understand that they're being reprimanded for their behavior while still allowing them to get that physical movement in during the day. So I think that covers some of those questions. Happy to answer more of those if needed. Additionally, in SB 25 were some health and nutrition standards updates. So SB 25 establishes the Texas Nutrition Advisory Committee. That's going to develop nutrition guidelines for Texas residents. And then it also is requiring districts to provide an elective course in nutrition and wellness. And then this one is, I think, not quite as, I think it's interesting, but it's not probably something you will deal with. But it requires a food manufacturer to include a warning label on food for sale that includes an ingredient from a list that's in the Texas Health and Safety Code. So it just may be something that you're seeing more in schools when you're providing lunches or food. It might come with a warning label going forward. All right, so another hot topic was what impact, if any, did the last session have on charter schools and districts of innovations in regards to SHAC requirements. So are charter schools and districts of innovation required to have SHACs? The answer is now yes. So SB 12 from last session changed this rule. SB 12 amended the education code under 12.104B, which lists the obligations of open enrollment charter schools to now include having SHAC. And then additionally, districts of innovation can no longer opt out of having a SHAC. Um, so that's kind of the big update there. And then there was another question about there, it's kind of a two-parter, but do public meetings have to be held outside of typical work hours? I think that question comes from the new Open Meetings Act requirements that require board meetings, board of trustee meetings to be held outside of typical work hours. That's part of the parental rights bill, is that they want parents to be able to attend these meetings. The So SHACs are going to fall under an education code in 28.004. It is similar to the OMA, but it's not exactly the same. So we don't think that SHAC meetings necessarily have to be outside of those typical work hours. It could be during the day. But just a reminder that the education code requires that SHACs post their minutes or their recordings and that those be available. So there's the requirements for SHACs and board meetings are going to be slightly different. And you can look at 28.004 for the requirements of SHAC meetings. Okay, another very hot topic bill was HB 1481. This is the cell phone prohibition. So this bill requires a school board to adopt, implement, and ensure compliance with the written policy prohibiting students from using personal communication devices on school property during the school day. Again, this was a very short bill, but it came with a lot of questions. So one question we get a lot is, what does the school day mean? So school day has not been defined. It's not defined anywhere in the education code. However, I think this comes from TEA. I think it comes from just the general sense that the school day is bell to bell. And so this is supposed to be prohibiting it during the school day as a way to improve the school climate, reduce students' use of social media during unstructured times, get kids to talk to each other. So generally speaking, I think the rule is bell to bell. So there's been a lot of questions about, well, what about lunchtime or passing periods? TEA has come out and said you should not be allowing your students to use to use their phones during lunch or during passing periods. So we now have clear guidance from TEA that your policy should prohibit students from using it during lunch. Another one we get sometimes is about, well, what if my students, have sports off of their school property? Well, if it's outside of school hours, that's fine. They're trying to communicate with their parents about when to pick them up or whatnot. That's, I think, a different situation. Um, okay, so we've talked about the lunch. Another question was, can students store the cell phones in their backpacks? So I think that's fine. The requirement is either that the policy prohibit the possession of the devices on campus or has a method of storage. A lot of districts are using the backpack as a storage method. You just have to have in place how are you going to ensure compliance with that policy. So I know that there are some districts that have chosen to invest in like yonder pouches or other methods of secure storage. That's not required under the bill, but you do have to have some method to store it, which can be a backpack. Just keep in mind that that might be tempting for students to stay out of their backpack as we kind of shift the culture to less time on phones. And then there was another question about what if earbuds are used as a calming intervention? Can that be an exception as part of an IEP? So the bill does carve out exceptions for students whose IEP has or 504 has accommodations for them to use a personal communication device. So that use may be allowed. It's going to be decided during their ARD committee meetings or Section 504 committee or any other committee. So that is going to be really individualized and part of their IEP, and it would be allowed. And there is a link here as well to one of the TEA documents about personal communication devices. Okay, now we're going to move into some of our related to wellness, to health and wellness, but not necessarily the bill we get questions about, but I think are still really important to know about. So SB 314 was about food additives in free or reduced price meals. So this prohibits school districts and charter schools from providing, as part of a free or reduced price meal, any food that contains a substance listed in the statute. You'll notice I did not include the list. There are a lot of ingredients that are named. So we've put a link there that you can look up. And I've attached the Texas Education Code section 33.9011B that has the complete list of substances. And then this only applies to a contract to provide for your reduced price meals entered into or renewed on or after September 1st, 2026. So this has the implementation on this is a bit longer. It's over a year. And it'll probably be something that, your purchasing department is working with providers to know, like, you can't sell these as part of your meals, those foods. So hopefully there's not a heavy lift for districts, and it's more on, just getting the right foods in place to be part of that contract. All right, the next one is HB 207. So it's about excused absences for mental health appointments. So this requires a school district to excuse a student's absence resulting from an appointment with a mental health professional in the same manner as any other healthcare professional. So if they're going to a doctor's appointment or a mental health professional appointment, there's no differentiation anymore, and those should be excused. And we can provide a link as well to some of that information. Okay. I think this is one of my last bills. HB 1586 is about immunization exemptions. This doesn't really change anything about the immunization exemptions. It's more of how parents can access the form. So this modifies DSHS's requirements related to the form for a student to claim an exemption. So now DSHS has developed a blank affidavit form that's it's now available. I'll show you in a moment, but this form was only available on written request, and that there was like a seal to prevent reproduction of the form. That is no longer the case. This is the affidavit. It's now available. A parent can download it and provide it to the school. So it's just made it a little bit easier for parents to access. And we've linked this as well, so you can take a look at it if you need. Okay, and then lastly, the SHARs program. So SB 1952 has moved responsibility of administering the SHARs program from TEA to HHSC. So HHSC is going to be in charge of overseeing the participation of districts in the program, and then as well as providing training and information and guidance. So you'll look to HHSC now. And there's also a link there as well to some of that information. That's all I have. So I'm happy to answer questions if I know the answer.
We have a few.
Okay,
If you have
great.
questions, you can please add them. Let me see. Go ahead and get you to stop share.
Yes.
What is SHARs? You want to answer that real quick?
Yes. So let me So it's the School Health and Related Services Program. I believe this is related to Medicaid reimbursements. This used to be handled by TEA, but that has now shifted to HHSC as to be the one to administer that program.
So back to earlier when we were talking about what could and couldn't be measured, um, and discussing things around health, the question came in, does this include growth and development for elementary? Do we need to opt in or opt out? Do you need clarification on that?
I let's see growth charts, like what a pediatrician I'm familiar with on that end. Um, I think it could be if it's a screener, if you're providing health information, I would probably get consent for that.
They were talking about
If
puberty lessons. So I think
so,
we're talking about health education. So
yeah, I think puberty, I think that could potentially fall under human sexuality. I'd probably get consent for that as well.
yeah, I would think so. That would definitely, yes, be an opt-in. If a school goes above and beyond the required minutes of physical activity in their wellness plan, could they take away movement at recess for the time they surpass in the requirement?
Let me see. I think I do see that question. Okay. I can pull up the statute right now, but I believe what it said, actually, I think I have it in my, believe what it says is if it's provided as part of the curriculum, um, if you're offering it as part of the district or school's physical education curriculum or their recess, um, I think if your district is providing it, I'd be hesitant to take it away. Um, I could see the argument that, well, we're doing above what's required. Um, but the way the statute is written, it's saying that whatever you're offering as part of your recess or your physical education program shouldn't be restricted. It doesn't talk about, well, if you've already offered the required amount of minutes. So just reading it on its face, I would not restrict it, even if it's above what's required.
Yeah, and Rachel Naylor, who's with the Texas Association of Health, PE, Recreation, and Dance, is on, and she concurs. There are no minutes attached to that statute, so
Yeah.
um, that would not negate anything that is taking away recess. Um, I don't know how the best, one of our districts says the superintendent is still telling, or TASB, the superintendent is still saying that SHAC meetings have to be held outside of the school hours. They want to know if they can get that in writing somewhere or somehow.
The way you would find it in that they have to be or don't have to
The
be is
question,
going to
yeah.
be in the Texas Education Code. So the requirements for SHAC are listed in terms of what their meetings need. So if it doesn't say they have to meet outside of typical work hours, then I think it's okay to meet during the day. But there are requirements about posting that should be followed.
Okay. Okay. I work as a health educator in our local health department, and we have educational presentations on basic nutrition, cooking, self-care, vaping, different CPR, and stop the bleed. We typically do these in a health class. Is a separate signed parental consent form. Is the school signed parental consent form sufficient, or do they have to have a separate one for the things they're teaching? Or is
Okay,
this
I
an
see that
outside?
question. So I think it's going to depend on how this, if this person is providing this in the context of a school day or a school on behalf of a district. I can't really tell from this question. Um,
So they're a health educator in a local health department, and they do presentations on
yeah.
different topics at the school.
Oh, at the school. Okay.
Yes, they
Um,
do them in the health class.
I would get the consent from the district. I think that's probably fine. They should include your curriculum as part of what their services are.
Okay.
If there's things like education on
So they would submit it to the district for
self-care.
approval normally,
Yeah.
and the district approves the curriculum, and it would be then considered incorporated into the district
Hmm.
curriculum. Okay. Can we have students use cell phones when we cannot reach parents due to illness, fever, etc.?
In terms of like texting a parent.
Yes.
Okay.
If the kids,
Um,
I'm assuming that the child was sick and they needed to
mhm.
get hold of their parent or something.
Um, I think I'd caution against that just based on the statute as written. They're not supposed to be using it. I think that's going to be up to the local campus to decide how to handle kind of more of an, I don't want to call it an emergency, but a medical issue and how they're going to contact parents.
Okay. Uh,
I know someone asked about TEKS. So if it's in TEKS, I think that'd be a little different. If you're talking about any kind of science or health education,
I think this one
um,
was relating back to the puberty.
the puberty,
Yeah.
that's probably okay since it's in TEKS.
But if it's human sexuality, I'm guessing
Yeah,
they still need to opt in.
yeah, they do. Yeah.
Yeah. Okay. And then we kind of answered this, but still, I think they're not clear. Is there an issue with recording height and weight for fitness testing since it does report out a BMI? Are we saying we don't want BMIs reported?
I don't know where I fall on this question.
Yeah.
I think that there's just a fine line between giving someone data and then giving like health education on that data or a health diagnosis based on that data. That's what I would caution against. Um, I think parents are under the law are supposed to be aware of what's being talked about with their student. So that's where I would potentially ask your local council about what they think on, since the statute's not super clear on, BMI as a fitness
Medical.
test, not a medical test.
Yeah. Okay. Well, Rachel, are you saying that the BMI data is necessary to meet the fitness testing statute?
There you go. Then you got to do
Correct.
it. Then
Okay.
you got to do it. And I did see Rachel's comment too about being careful about doing alternate physical activity if they're misbehaving, could fall into the punishment, which you don't want to do. Like physical activity as punishment isn't allowed. Um, and she says philosophically the wrong approach. I agree. You don't want to say, oh, you've been misbehaving, you have to walk, and now they don't like walking. Um, so I think it is going to be up to PE teachers to figure out how to keep students meeting. Maybe if the misbehavior is an issue with another student, you separate the students, they play two different games. You'll have to be a little bit creative on how to keep a student moving while addressing the misbehavior. Um, I think it's just going to depend on kind of how you operate your PE class.
And I think Rachel has offered to do a one pager on the, am I reading it
Yes.
correctly?
Yes, I will. And Amber asked if we could do that from Tape Rotor, and I will try to address that as well and get that done. Um, of course, we have to get the board to approve it, so it's going to move a little slower for us to get that done, but we will do it. The one thing about what we have been kind of commenting to teachers that reach out to us regarding discipline within the PE class is if it is part of your discipline management plan that they have like a 30-second, 1-minute timeout just to kind of reset, which we do with a lot of kids. That is part of your normal disciplinary measures, then that is okay. That is part of your normal disciplinary measures. But someone brought up like having a student stay in and write, do their homework, or,
Mhm.
they've been misbehaving in another class, you pull recess from. That is what the true intent of SB 25 is, to stop. It is
Yeah.
not to stop, you doing what your normal good management in a classroom is, which is, take a break, have the student have a moment to themselves, recoup, and then come back into the game or activity. If they misbehave again, you have all your steps that you follow as a good classroom management. That's not what SB 25 is trying to address.
Totally agree. It's a good distinction.
Someone's asking if the FA, I guess this will be a TEA thing. Could TEA put something in their FAQ for physical fitness that taking students' height and weight is okay?
Yeah.
I can yeah.
Sure. Comment on
I
that,
could
Michelle?
probably send a note to Barney, but maybe it would be better coming from Tasby than me.
So I think and there are places on TA's website where they are taking questions. So I would definitely submit that, or Michelle can submit and ask that question, because they've been updating their FAQs. So they know there are a lot of questions that are out there around some of these new laws.
And Brian, Rachel Naylor is with Texas Association of Health, PE, Recreation, and Dance, commonly known as TAFER, which is the physical educator organization for Texas. And I'm not sure which resources you're looking for, but we will send out information from this webinar to everyone who's registered, along with any specific links from Rachel or anyone else to any resources that they might have. And then we have a bi-monthly newsletter for Action for Healthy Kids. You can go to the Action for Healthy Kids website to sign up for. And then we also have the Texas SHAC Network. I'll put this up and leave it up for a minute, which you can join, that we send information out that relates specifically to school health advisory councils. And we also do a monthly SHAC chat, which you can come and ask any questions you might have around school health advisory councils or some of these new laws. We've discussed these a lot in the last couple of sessions we've had on that. Are there other questions we can ask while we have Kelsey and Rachel both here to answer them around the new laws? Or did I miss any questions? There was a very active chat. It would have been nice to have a separate questions only link, but I didn't have that today. So if you have additional questions, now's the time. We have a little bit extra time. You were very efficient in your analysis.
I was looking back through any of the questions we might have missed.
No? No more questions? The email I'm going to send will have our information as well as a PDF of the slides and the link to the recording, which hopefully the chat is also, I think, available. If not, I will send the document with all of the links that I dropped into the chat. They're also live on the PDF file that we're going to send. So you'll have multiple ways of downloading the different links to the different resources that we put into the PDFs. And if you could take just a minute to screenshot this or hit the link and fill out our evaluation, it can really help us moving forward on additional webinars, or let us know if you think we need to do another webinar on this topic, or a specific webinar on recess or some other topics. So if you don't mind filling out the evaluation, that will really help us moving forward. Any other questions? Rachel has offered her email up to those that might have some specific questions you feel she can help with. And we have, as I mentioned, Kelsey's or an email. The email on Kelsey's is for legal@tasby.org. That's to speed up the process a little bit. She may not be available, and they may have another person in their legal that can answer the question in a more timely manner. So you can reach out to that and you'll get a quick answer.
Yes, we're happy to answer questions. Just go ahead and shoot us an email, and then you would receive a call from an attorney, whoever is assigned that day. So we try to get back to people as quickly as we can.
We can do that, but I have to, and this, sorry, to get to the, the links, I had to stop sharing. Forgot to do that. There is the link, actual link for the survey. Thank you for all the kind comments. I appreciate that. We hope that you got some clarity on some of these pressing issues with the different laws. I think there's a lot of positives that came out of this session. Sometimes we're fighting for our lives to maintain things.
I do
So
have a
it's,
quick question.
yes.
Hey, this is Nurse Morris from Cedar Hill ISD, and I heard her say something about opting in.
Mhm.
So is that was that in the TEA draft or was that in the original bill?
Is this opting in for human sexuality or some of the
No, this
other?
is for health services.
Okay, so there's TA has kind of come out with well, they've come out with um, a distinction
Mm-hmm.
between what they call, let me pull it up. Um,
I actually saw that one on TEA,
okay.
but since it was in the draft form, our
Oh, yeah, I
nursing,
know what you're talking about.
our
Okay.
nursing
Uh-huh.
board, we still have to follow the original law because this is not finalized. It's still in a draft. So I was
Uh-huh.
asking if you had saw any information about opting in the original bill that came out. I know I saw it in the updated TEA.
Mm-hmm. Yeah, so what we have is the statute that was passed, so now that's the law. Um, there is language in there about parental notification and
Mhm,
parental consent and when
mhm,
you need to have those. And then what TA is putting out are some of the rules around the rulemaking of that. So we
mhm.
don't have like the official, this is the final draft of the rule. This
Right.
is just their model. It could change. It already has. Um, so I would go off of what their guidance, their draft rule is right now.
Mhm.
You can look at the statute for sure. This is going to spell it out a little bit more about where TA
Right.
is thinking of going with this rule. It has to go through the
Mhm.
rulemaking process. Um, I think it's okay to look at their guidance as this is what they've come up with so far. It may change. It already
Mhm.
has once, so keep an eye on it. But it does give a little more clarity than just the
Right.
statute alone. So,
Mhm.
and I think that's where some of the confusion for districts has come up because they're looking at the statute and they have a
Mhm.
bunch of questions. And so TEA is now kind of fleshing everything out to say, this is covered, this isn't covered. Um,
Mhm.
so I would kind of look at both.
Okay. So the way it is for us, because we are
Hmm.
licensed practitioners,
Hmm.
the guidance that the Texas School Nurse Association
Hmm.
put out along with the National Nursing Association,
Hmm.
because we are licensed, we still have to
Uh-huh.
follow the law. And so the opting in,
Yeah.
I mean, unless the district decides to do that, but as far as nurses,
Hmm.
we still have to follow getting consent for everything that we do. So, like yesterday, we had a meeting,
Sure.
and I told my clinic aides, "Hey, you guys can do the general caretaking, the band aid,
Hmm.
take the temp, but anything other than that, you still have to get consent. But my nurses, we still can't do anything unless we have a consent." because
Okay,
we
so
are
they're
under a
waiting on,
nursing license, and this
sure,
is
sure,
just in
of
the
course.
draft form
Yeah.
and it's not finalized.
And we've heard from nurses too about concerns about their license. So I would, of course, follow what your
Mhm.
licensing agency is telling you,
Correct.
because TEA doesn't cover your license.
Mhm.
The
Mhm.
nursing board would. So I'd follow what they say. I guess until it sounds like until the rulemaking is
Right.
finalized and considered part of law.
Okay.
Um,
I was just
so
hoping you saw it somewhere in the draft. I mean, somewhere in the original document that would make life a lot easier
yeah.
for us. But
Um,
right now, we still have to wait until it's finalized.
sure, sure.
So, like,
Yes.
yeah, that's fun. We can give some the medicine that's ordered because the parents signed consent for med, but
Hmm.
we can't give you a Band-Aid because they didn't sign the consent.
Um,
Because the medication is different. All medication that
yeah,
we give, like ordered medicine,
right.
it already comes on a form where the parent and the
Hmm.
doctor has to sign.
Okay.
Yeah.
You could also, I would recommend if your nurses in your school have questions or you have questions, I'd also reach out to your local council, or have
Mhm.
them call TADS because they can talk to you a little bit more in depth about it,
Right.
about what your policies can be,
Mhm.
in keeping with what the Board of Nursing is saying.
Right. Thank you.
You're welcome.
Oh, anybody else? Did that clarify for some of y'all? I know that's a tough one. I think they'll eventually get it all combined into one form so that you don't
Mhm.
have to, yeah, deal with the double duplication. So,
Okay.
and Gayla Wilson also mentioned components of an assessment do not require consent.
I saw that, and I would like for her to. I can put my email, and she can grab it real quick because I would like more clarification on what she's referring to.
Are you saying like the different assessments you do, vision, hearing, screening, those are not, don't require consent? It's like FitnessGram. Would that be what you're referring to? No?
I guess you mean maybe like listening to the lung sounds. I'm not sure.
Okay.
So I gave her my email. I put hopefully she got it.
Okay. Anybody else? Kelsey, thank you so much for spending time pulling this
Oh,
together
I
and
see what she's
hearing.
saying. If it's life threatening, yeah, of course we do that because that's emergency care. We still do emergency care.
Yeah, the vision and hearing screenings are going to fall under health assessment, so you would
Mhm.
need to have consent for those.
Correct.
Okay.
Um,
Oh, hey, Becca. Becca is there.
Okay. Okay.
Thanks for having me, Michelle. This was
Sure.
great questions. And that helps us know what people are asking out there.
Well, if anybody has questions after this is over and didn't uh, jump in and drop them in, just go ahead and email me at msmith. And we will work on getting answers or having another webinar if we need to at some point. Okay. Thanks so much. I'm going
Thank you.
to say goodbye. Y'all have a great rest of your week and good luck with all the new rules. Take care.